Hi, welcome to another travel video from Garyrose Travels. In this video I'm going to be talking all about hospitals and healthcare when you travel. Please click like and subscribe for more videos, and also visit GaryRoseTravels.com for all the best travel information. In this video you are going to learn what types of hospital are available when you travel, how much to pay for healthcare and insurance when you travel, whether chemists are any use to you when you travel and what you can expect to get from them, how to minimise the risks of going to see a doctor or a hospital, because sometimes it can be quite risky in itself going there. And please watch to the end of the video because I'll be providing you with some really valuable advice on how to avoid getting scammed when you are sick. So, first of all, what types of hospital are available? So generally throughout the world, hospitals and healthcare, it's a business. There's not many places which have free healthcare. We live in England, we live in London, so our NHS services are across the board. It's absolutely fantastic. Obviously we pay tax for this, but we're extremely grateful. And without the NHS, I'd be lost. I've used it so many times. But for many parts of the world, healthcare is a business. So because of this, hospitals are divided into absolutely super expensive, like some of the ones you get in Thailand. Their facilities are very good here, which is fine, but they're really expensive. And then you get kind of like a mid-range, and then you get tourist hospitals, which are perhaps a little bit expensive, and then you get government hospitals, and you get chemists, and then you get people who will remove all of your teeth for 20 quid at the side of the road. So for Gary and myself, we usually go with tourist hospitals or the government hospitals. So sometimes the costs can vary quite a lot. Obviously with the super expensive private ones, you can expect to pay hundreds of pounds. The facilities are often fantastic, again like the ones in Thailand that we've experienced. This is because there's an awful lot of backpackers and travellers who go there. You know, they're on their scooters, they crash, they break their legs, etc, etc. So yeah, they can afford to have some really fantastic equipment. They're very expensive. Personally, we've never used a really expensive hospital because we've never been in the situation where we've needed one. If we did, I would like to hope we had travel insurance to cover us for this, and I'll talk about insurance in a minute. So mid-range, look to pay between £40 to £60. Sometimes we've paid like £20 for things, but often we've paid between £40 and £60. This seems to be the going rate in most places. The facilities are usually pretty good. It's that people speak the doctors and nurses, that they speak English, and their written English is pretty good. So yeah, it's not bad. Perhaps they don't have all the best facilities, but yeah, they're pretty good. We've also been to see the tourist hospitals. These again, even better with the staff. Probably about £60 to £70, depending on what part of the world you're in. But they're usually pretty good. The standard is quite high. Often in some parts of the world where there's either tourism or nothing, some parts of Africa you tend to find that these are concentrated tourist areas, or there's absolutely nothing available. So obviously you have to pay out, which is fine. So yeah, sometimes you just got to pay out for tourist hospitals, but it's not a bad thing really. Government hospitals, we have used these quite a lot. Sometimes out of necessity because there's not been any other hospitals. Sometimes because it's been something like sickness and diarrhea, and you don't need to pay out a really expensive. You just need the medication basically. When it's been necessity, this has been a bit scary. I'll talk about that in a minute. But as a general rule, government hospitals are fine. Perhaps you just pay a nominal fee to see a doctor, and yes, you have to wait for quite a long time, and perhaps they don't speak the best English, all the staff, but generally speaking, they're okay. And they're pretty cheap and cheerful. You just got to like muscle in with the rest, the locals, and just get on with it really. yeah, government hospitals are absolutely fine. Sometimes, as I say, it's out of necessity. We've been places where there's been nothing aside from a small government hospital, and you just gotta go for it, really. So insurance, if you are going to put yourself at risk, perhaps you are planning on trekking in the mountains, perhaps you're going to do some whitewater rafting or something which is more than just sightseeing, you might want to consider taking insurance, because should you have an accident and you say break something, fracture something, you come off your motorbike and you skin your legs, you're going to want to have some really good healthcare. Obviously, if you feel like you want healthcare, you want insurance, and you want to pay out for it, regardless of your activities and your holiday, that's absolutely fine. But I would say if you are wanting to do something that's quite high risk, then you should probably pay out, because I've seen so many times people's holidays come to an abrupt end because they've had to go to a really expensive hospital for operations and treatment because they've skinned their sides when they've come off their mopeds. And it's really horrific, and their holidays come to an abrupt end because of their money. Also, if you are a budget backpacker, perhaps it's best to pay out for an insurance policy while you've got the money in England, as opposed to wait until you are away and then have to suddenly fork out. So if you want to save money, I would suggest get insurance policy before you go while you've got the money to pay for it, as opposed to that money being drawn from your daily budget. That's our advice. So, are chemists as good as doctors? In our experience, yes, they are. As I said, in many parts of the world, healthcare is it is a profession here, but it's a real business, and often chemists are really well trained, and quite high respected individuals. Very often, chemists can offer things like blood pressure checks and checkups, and they can dress wounds for you. They can do things basically that nurses tend to do, and also they're very popular because they're a cheaper option than going to a doctor or a hospital for many of the local people. Again, the Lonely Planet has reputable chemists listed, so if you're unsure, check that out. Also, you get tourist chemists, which again are very reputable, so check out the Lonely Planet before you go and see one. But yeah, we've been to see them when we've had sickness and diarrhea, and we have Giardia, which is a horrible waterborne parasite. We've had that. It's very common throughout the world. We've had that, and we've been to see chemists. Yeah, they're really good. They're, sorry, English chemists, but they're quite a lot more useful than the ones we get here. They're really hands-on, and they can administer quite a lot. Obviously, if you're unsure, go and see a GP. If a chemist has recommended something, you're not sure, then obviously go and see a GP. If you've been given the drug before and you know what it is, then yeah, take it. They're often very, very good chemists. So how you can minimise the risks involved. So, as I said, sometimes we've had to visit local doctors and local hospitals and local clinics. And when I mean local, I mean really local. There's been times when I've had severe food poisoning. Well, it was waterborne poisoning that I had. I was in a terrible state. I was vomiting and I had diarrhea for days. I was in a really bad way. I couldn't keep anything down. I had some contaminated water in a part of Rajasthan, which was horrible. So I had to go to the local hospital. Now, the only hospital which was available in this area was a really filthy government hospital. No reflection on the staff who worked there. They were really good, and they were as clean as they could be. They had on gloves and they had on clean scrubs, but the hospital itself was really disgusting. And I had to be put on a drip to get some fluid inside me, and I was quite scared. So also I was in a very bad way. I wasn't sure what was going on. So Gary actually sussed out the hospital first. He had a look around. We agreed it was disgusting. But what you can do in a situation like that, obviously we're worried about needles and things like that. What you can do is, once the doctor or nurse has prescribed you saline or whatever it is that you need, you can then go to the chemist and purchase the needle that is going to be stuck in you yourself. Obviously it will come in a a sealed packet, so it's sterile, so you know that that needle is clean. You can also buy things like the alcohol hand gel you can put on. You can ask the doctor or nurse to perhaps put this on. You can clean your own skin with it. With cotton wool, you can buy these things if you're not comfortable with what they have. So you yourself can do things. I know it's a little bit weird, and we'd never do that in England, but you can do these things. Perhaps you can buy, gloves and things like that if you feel it's necessary. So yeah, that's what you can do to minimise the risks of getting more sick. I mean, I wasn't sick afterwards. There was nothing else that was wrong, and I didn't pick anything up from that clinic, but it was a little bit scary. But that's definitely something you can do if you're feeling unsure. So how to prevent getting scammed? As I have said, across most parts of the world, all parts of the world basically, healthcare is a money-making fucking magnet, and people will use whatever they can. It's a business. They want to make as much money as possible. They're going to prey on travellers' insecurities and fears, and they're going to administer you things you don't need. So what can you do? First of all, you'll find that often if you visit a tourist clinic or doctor, they will prescribe you the antibiotic you'll need to kill off the bacteria that's making you, if you've got sickness and diarrhea, they'll give you some antibiotic to kill it off. They'll then give you some painkillers, which you've probably already got. They'll then give you something like Rennie's or Andrew's powder or something. It's not going to do any harm. It's not going to do a lot of good, but it's not going to do harm. Basically, they want to try and get as much money from you as possible. So they're going to give you the drug, the painkiller, and then something which you absolutely don't really need. What you can do in this situation is sometimes just buy it, and then once you've learnt from it, you can then the next time, oh actually I don't need this. You have to just be a little bit careful, because you can get scammed quite easily that way. And also you can ask the doctor who writes the prescription or the chemist to really outline, and also you can Google what are these drugs and do I need them before you purchase them. Obviously you'll need antibiotic, but do you need the others? Do you not have paracetamol? Do you not have something to settle your stomach? You probably do if you've done some shopping before you leave. So that's one way you can avoid getting scammed. The next way is actually on our last time away, we both got dengue fever, and we were in and out of hospital. We went to a tourist hospital. In the end, we ended up going to a government hospital, but anyway, so we went to the tourist hospital. And what you need for dengue fever is paracetamols and vitamin C. That's the treatment. You rest, you take this, and hopefully you get better, basically. So we were offered an MRI scan. We were offered a body scan. We were offered blood tests, which does diagnose the dengue. We were offered so many different treatments, all for about £90 each. But we'd already been diagnosed with the dengue. So all of these things were just, surplus. So we said, absolutely not. We then went back to the government hospital. They said, yeah, you've got dengue. Here's vitamin C. Here's paracetamol. Off you go. So yeah, that's something. So perhaps if you weren't sure exactly what it was, you could fall victim to this kind of scam. Luckily, we're pretty hard on backpackers, and we knew what it was, and we did our research into it. But if you weren't sure and you were quite scared, and which is understandable, you can easily fall victim to these scams. So yeah, please do be aware that people will just try and make money of you in your vulnerable state. I hope you've enjoyed this video. Please get in touch if you want any more help or advice, and remember to visit Garyrose Travels. Thank you. Bye.